The diagnosis of tuberculosis includes radiological and bacteriological examination methods, but it all starts very simply with a questionnaire survey at the family doctor's office. Therefore, it is important for everyone to remember that once a year, even if nothing is bothering them, they should visit their family doctor for a routine checkup and fill out a questionnaire that identifies risk factors for developing tuberculosis. Next, if a person has risk factors and the family doctor has reason to suspect tuberculosis in this person, or if the person has complaints that they come in with, we refer them for further examination. Radiological examination methods detect changes in the lungs and in other organs and systems affected by tuberculosis. This is a standard X-ray taken in 2 projections. Currently, computed tomography plays a leading role because it has higher resolution and allows us to detect changes in lung tissue as small as 1 millimeter in diameter. In other words, this is a highly informative method that immediately answers many questions and provides a comprehensive picture of the damage. There are also bacteriological examination methods. This involves analyzing sputum or other biological fluids. For example, if we have reason to suspect kidney tuberculosis, the sample would be urine. If it is tuberculosis of the nervous system, meaning the meninges, then the sample would be cerebrospinal fluid. But most often, of course, we examine sputum. In the general healthcare system, a family doctor has the ability to examine sputum using a smear, that is, to detect the tuberculosis mycobacterium in the smear. There is a special staining method called Ziehl-Neelsen staining, which makes it possible to clearly determine that, yes, it is indeed this bacterium present in the sputum sample. If a person has grounds to suspect tuberculosis, they are sent for further examination to the tuberculosis service, where there are more detailed and, let's say, more informative diagnostic methods. This includes sputum testing using molecular genetic tests, such as GeneXpert. It allows not only to determine the presence of Mycobacterium tuberculosis in the body, but also its sensitivity to one of the main anti-tuberculosis drugs, rifampicin. In other words, we immediately get answers to 2 questions. First, is the microbe present in the person's body? Meaning, is it truly a tuberculosis process? And second, is this a drug-sensitive process, or is it resistant tuberculosis, which cannot be treated with first-line drugs and requires an individually tailored treatment regimen? In children, the Mantoux test is used for diagnosis. It is not administered to all children. It is given to children who have risk factors. If the pediatrician or family doctor has reason to suspect that the child has risk factors for tuberculosis, the child is referred for a Mantoux test. This is a specific skin test. Tuberculin is injected intradermally, and the child's bodily reaction to the tuberculin is monitored. There are clear criteria that allow us to determine a negative test means the child is healthy, a doubtful test means the child needs further examination. And a positive test indicates a high risk that the child has tuberculosis, or that the tuberculosis mycobacterium is circulating in their blood, meaning there is latent tuberculous infection. There is also the QuantiFERON test. This is also a very reliable examination. Unfortunately, it is only available in private laboratories here. These include SmartLab, DILA, and Cinevo, because unfortunately, due to its cost, our government cannot provide this testing to the general public for free. Therefore, it is done privately, but it is also informative and allows us to determine the presence of latent tuberculosis infection, that is, the circulation of tuberculosis mycobacteria in the bladder, the presence of the disease in a child.